My mother was notified that she did have precancerous cervical cells. She served in the U.S. Army. Unfortunately, she was not able to get any cancer care from the VA because of my father's income. My father made too much money for the VA. My father made too much money for Medicaid, but he did not make enough money to pay for the surgery.
Nearly 4,200 women in the United States this year alone will die from cervical cancer. In Alabama, the rate of cervical cancer deaths is higher than in any other state. Black women are twice as likely as white women to die from cervical cancer in Alabama.
My mom held on until she turned 65 and got her Medicare benefits. About this time, it was too late.
Some of the barriers to access to care for women, particularly in Alabama, are access to consistent coverage for insurance. Also, there just aren't enough doctors in rural Alabama. And because there aren't enough doctors, transportation to the health system becomes a significant barrier.
It is sad to say that in 2018 that a woman that's diagnosed with cervical cancer would have the same transportation issues, would have the same healthcare provider issues that my mother faced in 1980.
Ms. Frances Ford is a tireless advocate for rural hospitals, particularly in her county, Perry County. She also lost her mother to cervical cancer 30 years ago.
The quicker we can get in medical attention, then it means you have better outcomes and things just work out better. We do not have an OBGYN in Perry County, and so it's not possible to receive specialized care.
If you can't get that initial care, and then you compound that with, well, what if it does come back as cancer, and then you can't get the treatment on time, you're basically telling me that I might die from something that was preventable? That doesn't make sense to me in the United States, the richest country in the world.
Up until a couple of months ago, Dr. Stevens was the only OBGYN in a 5-county area.
Some of our patients will drive 2 hours. I mean, they can't get here. And a lot of times that's money, pure money. You catch these things in their precancerous stages and they're a breeze to take care of.
I took pictures. I wanted to remember that.
And when she got sick, it was just unbelievable. I even talked to my doctor about getting her help. First thing he asked me about her insurance. I said, well, we're not worried about insurance. He said, something wrong with my wife. And he said, well, in other words, he just turned it down.
If my mom was able to have Medicaid, I believe that we're preventing the precancerous cells from growing and turning into a tumor. All this could have been avoided. I think that by her not having health care, that it kind of like was a death sentence.
When she passed away at our funeral, I gave the eulogy. I wanted everybody to know about my mother, her legacy that she left. I'm a college band director, and the only way I knew to do it was the way I speak every day, through my band.
My hallelujah belongs to you.
Everybody should have insurance. I really feel that way. These are people's lives we're dealing with. Like, I don't have a mom right now.
I know people that have 2 incomes, go to work every day, and don't have insurance because they cannot afford insurance. And they have to make a decision. Am I gonna pay my bills? Am I gonna pay for daycare for my child? Or am I gonna pay for insurance? And sometimes people have to make decisions. And sometimes you have to think about right now.
The health priorities that Black women face are definitely linked to the economic challenges. Black women make 61 cents on a dollar in comparison to white men. I mean, you can open up the floodgates in terms of how economics can be related to structural racism.
As a Black woman, I feel like a lot of times my issues may be ignored. Sometimes Black women are seen as a little bit more difficult. And then just because sometimes we don't seek care as early, and a lot of it has to do with us having bad experiences with the doctor.
There is structural racism and provider bias in the system.
People don't realize when you're not important to the government, there's a family there. There are kids, there's a spouse.
Cervical cancer deaths shouldn't happen in the United States. This is a preventable form of cancer, 93% survival rate if you catch it early. Lawmakers in Alabama can step up, expand Medicaid coverage to more people, and really take steps that will save the lives of the women that live in their state.